in the room.
Let's rock and roll! Yes! Come in.
Hello, how are you today?
I'm good, how are you?
Good, my name's Jill. I'm a student at University of Detroit Mercy. I'm here to do a head-to-toe assessment with you today. Is that okay?
Yeah.
Okay. I'm going to wash my hands and close this curtain for privacy for you.
Okay.
And what was your name?
Angelica Ferreira.
Okay, and your birthday?
July 22nd, 1980.
Okay, I'm just going to make sure that matches your wristband, which it does. So that makes you how old? 35. Okay, congrats. You look good for your age, but you do appear to be your age. And are you from this country?
No, I'm from Brazil.
Okay,
Yeah.
so I can understand her speech. It's clear for the most part. It is hard to hear a little bit, but I understand what you're saying. You have good tone and speaking correctly. The appearance from the outside looks to be well, no illnesses. I don't see any like lesions or anything from the first eye, no bruises or anything like that. And then do you know where you are today?
Yes, University of Mercy.
Okay, do you know what time of the day it is?
I believe it's almost 11.
Yep, that's right. And then do you know what floor we're on?
Second floor, the field health professional.
Yep, that's right. So my patient is learn-oriented ×3. Upon looking at my patient, she is well groomed. I don't smell any odors from her mouth or any other locations of the body, so that's good. Well hygiene. So go on head forward. I'm just going to go ahead and start from the head down and work my way if that's fine.
Okay.
Upon looking at your face, it's beautiful. Nice smile. Can you smile for me? Good. Puff your cheeks out. Good. And can you wrinkle your eyebrows? Okay. Can you close your eyes for a minute? Can you feel this?
Yes.
This?
Yes.
And this?
Yes.
Good. So that means that your cranial nerves 5 and 7 are intact, so that's awesome. I'm going to go ahead and check your eyes now.
Okay.
Can you go ahead and follow this light for me? Good. Okay, and then look straight at me for a minute. Okay, coming around. Good. So your pupils are round, equal in size, about 3 centimeters. They're reactive to light and accommodating, so that's really good. Do you wear glasses?
Yeah, I do wear
Okay, because I noticed your eye a little bit when I was doing
I have
that.
lazy eye.
Okay. But otherwise, good. And then I'm going to go ahead, overall skin looks fine. I'm going to go ahead and check your carotid arteries now. So first, sorry, I'm going to feel them first. So those are equal bilateral. I would say 2+, so nice strong pulse, so that's really good. I'm going to go ahead and take a listen next. Okay. Nice strong sound, really good. Okay, sounds good, no irregularities there. Okay, I'm gonna go ahead and if you can open your mouth for me. Okay, stick your tongue out. Oh, not too far, just kidding. Go ahead and say ah. All right, so her teeth are nice and white. Do you have any cavities? No, doesn't look like it. The oral mucosa is nice, pink and moist. No coating on the tongue. The uvula moved upon saying ah. Tonsils I would rate as a +1. No cracking or anything of the lips, so those look nice and moist. You must use chapstick. Good. Okay, so next I'm going to go ahead and move on down. I'm going to go ahead and listen to your heart. Okay, so listening to the heart here, to the right of the sternum border, the second intercostal space is going to be the aortic area. Nice and loud there, so we're going to be able to hear S2 loudest in this area here as well as over here, which is going to be the pulmonic. So that's going to be the left of the sternal border too. Moving down is going to be the herb space. Your heart sounds really good. Next, we're going to go over to the tricuspid and mitral. Very loud here, sounds really nice and strong. I would listen here for a minute. this is also going to be the loudest area for the S1. So going back up with my bell, I would be listening to the same areas as just mentioned. The intercostal spaces here was 2, 2, and then herbs would be about a 3, and then about a 4 intercostal space for the tricuspid, and 4 to 5 for the mitral there. Okay, so sounds really good. No irregularities there. Nice strong sound. Okay. Next, I'm gonna go ahead and actually while I have these on, we're gonna go ahead and listen to your lungs. Okay. So far, so good.
Good.
So I'm gonna go ahead and upon every breath, she would do a full inhalation and exhalation. I would listen to each spot, but for her purposes, we don't want her to pass out, so I'm just gonna touch the spots that I would be listening for. So we have 1 here, 2. Okay, I didn't hear any cracking or wheezing there. Lungs sound nice and clear on the front. I'm gonna listen to them laterally and then to the back. So you can go lift your arm up a little bit. Okay, doing well. Okay, coming to the back. Same thing, it would be a full inhalation and exhalation for each. So we go across the street and to our neighbor. Okay. So upon listening, I didn't hear any wheezing or cracking. Her lungs sound clear. Since I have my stethoscope out, I'm also going to listen for any bruits on your carotid. So go ahead and look up straight for me. Okay. Sounds clear. No abnormalities there, also sound clear on that side. Good. All right, since we're in the back, I'm gonna go ahead and have you lean forward just a smidge. Do you feel any pain?
No.
Okay, spine feels good, normal, normal and straight. Do you feel any pain here and tenderness?
No.
Anything here?
No.
Okay, good. So kidney function seems to be good. I'm gonna go ahead and check your diameter here. So we have a 1 to 2 AP diameter for that as well. So far, so good. I'm gonna go ahead and just look at your upper extremities here. Just gonna feel ya. Sorry if my hands are cold. Warm to touch. Appropriate skin color for ethnicity. I don't see any lesions. Maybe a couple freckles or beauty marks here. If I did notice something, I would use the ABCDE method, which is a symmetry, border, color, diameter, and elevation or evolution. So that is awesome. I'm gonna go ahead and also palpate here your trying to feel these here. So your brachial arteries. There they are. Nice pulse there. 2+ I would grade those bilaterally. Coming on down radial pulse here. There they are. I would say +2 bilaterally as well. Okay, can you flip your hands over? Nails look good, no clubbing. They look nice and filed. You must have got a manicure recently, they look nice. Checking for capillary refill. Those return back within 3 seconds, so that's normal and good. You can go ahead and squeeze my hands for me. I'm just checking strength. Good, you've been working out. So good strength there bilaterally. Awesome job. All right, if you don't mind, can you lay down for me just for a minute? Power outage. Sorry, I hope that didn't scare you, ma'am. We're just gonna continue. I think they're working on the power out there. If you can lift your gown up for me and lift up your shirt. Awesome job. Okay, upon inspection, I don't see any lesions. Did you ever have your belly button pierced?
No, never.
No, you never got into that craziness, huh?
No.
Okay. So, upon inspection, no, your belly looks awesome. I don't see any striae, no lesions, no abnormalities, no bruising, no incisions from previous surgeries, anything like that. So she looks good. Belly button is midline, and looks fine and normal. I'm gonna go ahead and listen to your bowel sounds now. You always want to make sure you listen before we move anything around and feel, okay? So I'm going to go ahead and start down here. The right lower quadrant, I can hear some action there. Right upper. Okay. Bowel sounds are present so far. If I didn't hear anything, I would be listening for 5 minutes, but luckily we hear something in each quadrant. I heard a little bit of rumbling. It was pretty loud. Nothing abnormal there. Some tinkling, crackling, crumbling. I'm gonna go ahead and touch you now if that's okay. Let me know if you feel any pain. No pain there. Okay, so that's gonna be our right lower quadrant. Here we're gonna find your right ovary as well as your appendix. So that's good. You don't need a appendix removal since you're not in there. Right upper here is going to be your liver and your gallbladder. Left side upper is going to be your spleen and your stomach. No pain so far?
No, no pain.
Okay. Left lower here is going to be your left ovary and your sigmoid colon. So no pain anywhere there, huh? Okay, you can go ahead and put your shirt down. Thank you. Doing good. Next, we're gonna go down to your legs. We're almost done with the test, okay? Okay. Warm to touch here. No swelling, no edema. Looks good. Nothing hurts when I do that. No? Okay. I'm gonna go ahead and feel for your post-tibial tibialis pulses, which feel good. I would rate them as like a 1+ though. They're a little more faint than your upper extremities here. Moving on down. Dorsalis pedis. Those are about the same, about a 1+ bilateral for both. Okay. Can you go ahead and push up on my hands for me? Good. And then can you push down on my hands? Good. So the strength is good bilaterally for that. I'm going to go ahead and just look at your toes. They're painted. So for the capillary refill, I'm going to look on the back sides of your toes. The refill looks good within 2 to 3 seconds. So that looks good. Nails look fine. No clubbing there. Okay. All right. So far, so good. Can you stand up for me?
Yes.
Okay. Good job. All right, we're almost done. Now I just want you to go ahead and just walk 10 steps. Turn around. Be careful. All right. Good. Do you feel dizzy or anything like that? Okay. So that is a negative test for the Romberg's test. So that is good so far. You don't feel dizzy. No. Can you close your eyes for me? Okay. So I'm going to watch you for a few seconds here. Do you feel wobbly or dizzy?
No.
No? So that's going to be a negative test. Oh, sorry. This is the Romberg's test. That was the walk and go test. Okay. Good. Go ahead and sit back down for me. Since we're doing all lower body and legs and stuff, I did just want to double check this for you really quick. Coming on the outside. Checking the Babinski test. Okay, good so far. So that is going to be a negative test. Your toes stayed straight. If they were to curl, that would be good too. If they were to be spread out, we would maybe have some neurological problems. So good. Good so far.
Thank you.
You're welcome. Is there anything else?
No, I'm good. Thank you
I hope
very
not.
much.